In Health Watch now, the CDC says the number of measles cases being reported is close to the danger zone. The number of measles cases in the U.S. has now hit 695, making it the country's worst year for measles since 1994. That year saw 963 cases.
Doctors say about 94% of the country is vaccinated and are urging vaccine-hesitant parents to get their children immunized.
So joining us now is staff writer for The Atlantic and Dr. James Hamblin. Thank you so much for joining us. First off, let's just sort of put these numbers in perspective. What did these numbers tell us?
Well, they tell us that measles is back. This is a disease that was declared eradicated in the country in 2000, so 2 decades ago. We thought we were done with it, but it is coming back very quickly, which is concerning, in multiple pockets across the country.
So, Doctor, why is the United States having such a hard time controlling the spread of measles?
A lot of it comes back to information, misinformation, misconceptions, and actually concerted disinformation campaigns where people misunderstand the risks and benefits. And it's complex. People have different relationships to the medical system. And also your perception of risk sort of wanes over time. When you forget that measles is an actual deadly disease, it becomes easier to become susceptible to thinking about harms of vaccines as minimal and almost non-existent as they are.
I'm not sure if you know the answer to this question, but we just read out, some statistics saying that so far this is the worst year since 1994. 1994, 963 cases. Do you know what happened in 1994? Now, as I understand it, we're just a few months into, maybe almost halfway through this year, and we're already at 695. So who knows where we're going to end up at the end of the year? But what's up with 1994 being a bad year for measles?
I don't recall 1994.
Okay. Just sort of curious.
I'm sorry. It was generally, though, it was on the decline from the 80s and 90s until 2000, and there were some outlier outbreaks, as there are with any infectious disease. But generally, there was a real good line of progress over the course of decades, and for a number of reasons, we're going back in the opposite direction, which is the general really concerning trend.
Right.
So it's interesting to me, too, Doctor and Anne-Marie, because I noted the countries that we just showed on that graphic there that are leading the world in number of measles cases reported: the United States, the UK, France, Italy. I didn't see Canada on that list, interestingly enough. And I remember as a child getting vaccinated for measles, MMR. It was just the thing that you did. You would start school, and your parents would say, you got to get these vaccines, or the school nurse would say, you got to get these vaccines. And I've gone back to this repeatedly when we covered this story, Doctor, which is that I've worked and reported from countries, a lot of third world countries, where thousands, if not hundreds of thousands of people have been affected by horrific diseases that have been eradicated in the United States and in first world countries. And when you see a country like the United States taking a step back, and when you talk to families in other countries where they don't have readily available vaccinations for their children, and they just look at us and they wonder, they scratch their heads and say, how? If you have this available to your children, to your people, are you not ensuring that everybody is protected? Whereas we would give anything to have the kind of medical technology that's available to you in the U.S. So it just is sort of boggling to me. And I note that Canada's not on there, Anne-Marie, because I'm guessing you're not having that same problem that you have in the United States.
I saw that too, and at first I thought about the public healthcare system, but France has a public healthcare system.
True.
So does the UK, and you would think that the government would be particularly proactive if they had to foot the bill.
Right.
So I can't say what the difference is. But I'm curious. We're looking at a list of countries that are, where access to information is at the fingertips of everyone.
Right.
Great education, but this is not just happening here; it's happening in other countries. What's going on? Is this a global phenomenon of misinformation? Is that what it is?
It is global, and that was what's really concerning. The World Health Organization announced this month that numbers are up 300% over the same period last year globally, and 110,000 people died of measles in 2017. So as significant as this is in the United States, it's a much bigger problem globally, and the pockets of disinformation that are emanating from places like the United States, where it's not a huge problem, are having effects in places where it has long been a big problem and continues to be. So this requires a global approach, and we're all in this together. And the spirit of understanding that infectious disease is not an individual battle. It's about communities.
Yeah, well, we've done interviews on how, misinformation coming out of the U.S. through various platforms like Snapchat are making their way to India,
right,
where, an outbreak can be absolutely devastating. It still boggles the mind.
It's disconcerting. Dr. James Hamlin, thank you, sir, for being with us. We appreciate it.
Thank you for having me.